Hey y'all, did you know that a confused patient literally never says yes to anything that we offer? They don't say yes to treatment that we've recommended. Now, if they like you and they believe in you, they will give you a second chance. But just remember that it doesn't really work to offer patients lots of options. It's good to let them know that they have options, but it's best to actually give them your best option. Give them the opportunity to say yes to your best. So when you're treatment planning, remember that it comes down to really trying to understand what they want and need from us, which is why we want to really listen in and try to be a sleuth for that M&M every time in the transfer of care. If you don't get the M&M, if you're just really getting a primary interest or primary concern, then ask for it. Ask them to tell you more. Ask them to help you understand how things are affecting them, what's going on in their life as a result of this dental condition. Okay. The second piece then is to really pay attention to their dental and medical history. Yes, that boring stuff from dental school, it matters. Okay. Did they say something about a bad experience? Did they say something about bleeding gums or breath or whitening or their smile? And then they maybe don't say it verbally. So ask. You have to ask. Use the way that they rated their smile, the way they rated their dental health as a way to understand the way they see it. What's their connection to the reality of their dental condition? And then how can you help them close the gap to where they want to be? From there, remember when you're treatment planning, think about efficiency as much as, how it goes. If you recommend, hey, I'd like to treat the right side of your mouth first and then the left side. If you do it that way, and then let's say your schedule's going crazy, you maybe don't get it all done, but you actually, you get part of it done, you still have some more left, you can always just say, hey, look, a few things took a little longer. I'm going to need to come back and finish up a few things in that area. That's fine. Remember, sedation is your friend if you need to be able to do their whole mouth. Those are always options for you. The other thing is that, Dr. Hart talked about where I've always talked about the contrast principle, the idea that if right now patients come to you and they're thinking, yeah, it's a $10,000 treatment plan. Oh my God, that's too much, because they're comparing it to zero. But if they're comparing it to 20,000 or 30,000, 10,000 doesn't seem so bad, right? And it's always about stretching their mind and helping them understand that yes, this is a worsening condition. It can get worse. So give them your best option, help them understand where it's going, the other side of the problem, and that the cost is just going to get higher. And so if we're worried about their pocketbook, understand that if we don't help them be able to say yes and get started on something right now, it's actually going to cost them more in the long run. So I always say, hey, look, I know this feels like a lot. It may feel overwhelming. It may feel like it's more than you can afford. But I also want you to know that if we don't get started on this, it's just going to get worse and worse. And I'm going to, we try to save money now. We end up saving you poor by trying to cut corners or anything like that. And next thing you know, you've spent twice as much to get the job done that we could have just done right from the get-go. And so that sort of thing helps patients get their minds around this. We have to be able to manage all aspects of that. And I think that when we do, you'll find that your results go up and patients appreciate it. They trust you more. You have to show that you are thinking about them. You're not thinking about their pocketbook. You're thinking about what's in their best interest in every way possible. And when you do it that way, I think you'll find that your trust is higher. Patients say yes more, they refer more, and you've got a lot of momentum in your practice. So I hope that helps. Hey, go have a great day, guys, and we'll talk to you soon.